When I was first diagnosed with diabetes, I was in the process of practicing to dance with Savion Glover and preparing to dance at the Apollo Theater. One day after practice, I got very sick and I was diagnosed at that point when I was 13 years old. It didn't necessarily change my life initially, but I had to redirect my energy to focusing on health first. They had told me about needing a kidney back home. It was 5 to 7 years for a kidney, but there was never an option for a kidney and a pancreas at the same time. So when I got out here, that's when I was talking to the doctors and I learned that you could do both at the same time. And my first initial reaction was, no way. Having diabetes for almost 30 plus years, and you mean to tell me that it can all go away at the same time? And when they told me that that was a possibility, it gave me a lot of hope.
So for many patients who have end stage or chronic kidney disease, it's tied to their diabetes. And for many of these patients on insulin, we can try to cure both issues, the kidney disease and what may have caused their kidney disease in the first place, their diabetes. And so we look at kidney-pancreas transplant together as a way to attack both problems and solve both problems.
The way that Mayo Clinic and the team operate is one of the best and most amazing parts of my journey. It was just an abundance of joy. That's my next goal in life, is to start dancing again. Dancing for me is like dancing with God. I feel like his spirit is in the room and it helps me a lot. The inspirational part for me is that people don't give up. And there's places like Mayo Clinic that can help as long as they continue to fight, as long as they continue to believe, and as long as they're willing to make the sacrifices that are necessary to walk the walk. This is the ultimate place to do so.